Welcome to The Explainer. Today, we're diving headfirst into one of the most high-stakes situations in all of medicine, the neurological emergency. This is when the body's central command center is an absolute crisis, and believe me, every single second counts.
Okay, let's just jump right in with a scenario that cuts to the chase. You've got a patient in front of you, and they're unresponsive. Right away, your brain has to ask that one fundamental question: what core system is failing? And so often, the answer is the nervous system.
And that's what we call a neurological emergency. We're not talking about a simple headache here. These are genuinely life-threatening conditions. Something has gone critically wrong with the brain, the spinal cord, or the nerves, and you have to move fast to stop permanent damage or even death.
Now, when the nervous system is in this state of critical failure, it almost always shows up as a breakdown in one of three fundamental life-sustaining functions. You can think of these as the three pillars holding everything up.
And here they are: consciousness, respiration, and circulation. This core triad is your first filter. An acute problem with any one of these points a huge flashing arrow right at a neurological cause. It gives you an immediate focus.
So, let's break this triad down, shall we? How exactly does a problem in the nervous system cause these vital functions to just fail?
First up, respiration. Our brainstem tells us to breathe, but if pressure inside the skull gets too high, it can literally squeeze the brainstem and shut off that signal. The problem can also be out in the periphery. Conditions like Guillain-Barré can paralyze the very muscles you need to breathe. Either way, the danger is hypoxia, a lack of oxygen that then causes a second wave of injury to the brain itself.
Next is circulation. The nervous system can directly mess with your blood pressure and heart, like we see in spinal shock. But more often, a systemic issue, like a cardiac arrest, stops blood from even getting to the brain. The end result is the same: global cerebral ischemia. The brain is being starved of the blood and oxygen it desperately needs.
But the most complex failure, and the one that's really unique to neurology, has to be consciousness. And it's not just a simple on-off switch. To really get what's going on, we need to break it down a bit further.
See, to really assess consciousness, you have to separate arousal from awareness. Arousal is just wakefulness. It's run by a part of the brainstem called the ascending reticular activating system, or ARAS. Think of it like the power switch to the whole system. Awareness, on the other hand, is the content of your thoughts. That's a higher function of the cortex. It's crucial to remember a patient can have one without the other.
And this distinction is what helps us make sense of these different states. So somnolence, stupor, and coma, that's a spectrum of failing arousal. The power switch is dimming, or it's completely off. But a vegetative state, that's a failure of awareness. The patient's eyes might be open, they might look awake, but that higher cortical function just isn't there. The power's on, but the computer's operating system isn't running.
Okay, so you figured out the core problem. It's a failure in that triad. The situation feels chaotic. So how do you bring some order to it? What do you actually do?
This right here is your playbook. First, always, you secure the ABCs: airway, breathing, and circulation. No exceptions. Then, you get a baseline level of consciousness using something like the Glasgow Coma Scale. From there, it's about gathering clues, getting a history, looking for signs of trauma or infection, and finally, testing those key brainstem reflexes. This is how you go from pure chaos to clarity. And that history, even if it's secondhand from a paramedic, is so important. It gives you critical clues. Did this happen suddenly out of the blue, maybe with weakness on one side? You've got to be thinking about a structural problem, a stroke, a bleed, some kind of trauma. Or did it come on slowly, over hours or days, maybe with a known issue like diabetes? Well, that points you towards something metabolic or toxic. The timeline tells you the story.
Okay, now we need to talk about what is arguably the most time-critical, must-not-miss neurological emergency of them all: increased intracranial pressure, or ICP.
So pressure inside the skull goes up for pretty much three reasons. One, there's a mass lesion, a tumor, a bleed, something that's physically taking up space. Two, you've got a blockage that's stopping the normal flow of cerebral spinal fluid, which is a condition called hydrocephalus. Or three, the brain tissue itself just starts to swell up, what we call cerebral edema.
And here is the fundamental, terrifying problem. The skull is a rigid, bony box. It cannot expand. Unlike a sprained ankle that can swell up, a swollen brain has absolutely nowhere to go. The pressure just builds and builds and builds.
The ultimate danger here is that the brain itself gets squeezed so hard that it's forced out of its normal compartments. This is called herniation, and when it happens, it can crush the brainstem, shutting down breathing and consciousness for good. This can cause death in a matter of minutes if you don't act.
And this brings us to one last critical question. With that pressure rising and the threat of herniation looming, you need a quick way to know if the brainstem is still online. When every single second counts, what is the one reflex you check first to get your answer?